scene is considered safe. I'm wearing the correct PPE, which is gloves and glasses. So I'm just going to introduce myself to the patient. Hi, I'm Aisha. I'm from New South Wales Ambulance. What's your name?
I'm Lucy.
Lucy, nice to meet you, Lucy.
Nice to meet you too.
So I'm just going to explain the procedure to the patient. So I'm just going to be performing a neurological assessment on you today. Is that alright?
Yep.
Yeah, that's fine. And you're in a comfortable position?
Yep.
Perfect. So now I'm just going to be calculating the AVPU score of the patient with A being alert, V being responsive to verbal stimuli, P being responsive to painful stimuli, and U being unresponsive. So the patient is alert in this case. So I'm now going to be just performing a fast exam on you. Is that alright?
Yep.
Okay, so I'm just going to be looking at the patient's face. So I'm just looking for any drooping, any swelling, any sorts of things like that. So I'm just going to ask you to do a big smile for me. Perfect. So the smile is unilateral, no problems there. So now I'm just going to ask you to close your eyes, and if you could just extend your arms out. Perfect. So I'm looking for any natural dropping, anything like that, but I'm not seeing any signs of that. Can you just squeeze my hands for me? Yep, so there's equal strength. So now I'm just going to assess the speech of the patient. I believe they're fine, there's no concerns there, but how are you doing, Lizzie?
I'm good, thank you.
Yeah, that's fine. The patient's talking in nice sentences. So now I'm just going to be considering the AEIOU tips. So this will help assess the mental status of the patient if I figure out what might be happening. So A is alcohol acidosis, E is epilepsy, I is infection, O is overdose or underdose, U is uremia, T is trauma, I is insulin, P is psychosis, and S is stroke. So now I'm just going to acquire a BGL from the patient. So can I just grab your hand? So you're just going to feel a sharp prick. Perfect. So normal values are between 4 and 8 millimoles. So anything under the 4 would be hyperglycemia, anything over would be hyper, so we'll just be watching out for that. Okay, so now I'm going to calculate the GCS of the patient. So we're going to start with I response. So with 1 being none, 2 being response to pain, 3 being response to voice, and 4 being spontaneously opens them. Next we're going to move on to verbal. So 1 is no response to verbal, 2 is incomprehensible sounds, 3 is inappropriate words, 4 is confusion, and 5 is orientated. And now we're just going to move on to the motor response. So 1 is no motor response, 2 is extension to pain, 3 is flexion to pain, 4 is withdrawals from pain, 5 is localizes to pain, and 6 is obeys commands. So overall the patient has a GCS of 15, which is perfect. So now we're just going to use my pen light, and I'm just going to shine a light in your eye. Is that alright?
Yeah.
Perfect. Alrighty, so I'm just going to do this lateral to medial on both eyes. Awesome, so the pupils are 2 millimeters, which is perfectly fine. Pupils are equal and reactive to light, so I've got no issues there. Next, I'm just going to explain the the findings to the patient. So I calculated the AVPU, did your fast exam, considered the AEIOU tips, performed a BGL, and calculated your GCS. Overall, I've got no concerns. Might take you to hospital anyway, just because we will really want to rule out any of the 9 conditions that I said to you before. But other than that, you are good.